Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shob. On the program tonight, the COVID situation in India now clearly getting from bad to worse. Maharashtra has reported 8,807 new cases in the state today, 80 COVID deaths, the case fatality at 2.45%. Now this comes at a time when the government has taken a momentous decision to allow millions of citizens to be vaccinated with the partnership of the private sector starting early March, perhaps even the 1st of March. Now this is for those above 60 and those above 45 with comorbidities. You can either get the vaccine free if you go to a government facility or pay for it in private. Now we have on this program the best panel in India really on this. Dr. Randeep Guleria, Kiran Mazumdar-Shaw, Dr. Swati Piramal, Dr. K. Srinath Reddy, Dr. Sangeeta Reddy and Abhay Soy. They'll all be joining us on this program. We'll go across to Dr. Randeep Guleria first, however, in a few moments, but also it's a 1-hour program today, and later on the program, the Motera Cricket Stadium will now be called the Narendra Modi Stadium, a part of a larger sports complex named after Sardar Patel. But the question that we're asking tonight, should public spaces in India be named after political leaders? This is a reality that we've had for decades. Why is it that we don't have cricket stadiums named after cricketers, while there is no dearth of them named after political leaders? But that's much later on this program. What we'll do is go straight across and try and get as many answers as possible on the issue of how the private sector will start this process. Dr. Randeep Guleria joins us now. Dr. Guleria, first up, before we actually get to all of these questions that have been sent in to us, the Maharashtra situation, the numbers have just come in. What does this indicate to you? And, are we seeing this going up very sharply? What is your thought on the numbers?
So I think this is a cause of concern because there is a spike in the number of cases, and this has been seen for the last few days. And therefore, the trend is not very encouraging. And therefore, I personally feel we need to be very aggressive. We need to sort of literally nip it in the bud because the situation in our country is good. But we've seen globally that this situation can change very quickly, and therefore in terms of testing, tracking, isolating, developing containment zones, and possibly also trying to vaccinate as many people as possible in that area like UK did, we need to develop strategies in that manner so that we're able to contain the spread of infection and make sure that it doesn't spread to the rest of the country or to other parts of the state.
And so, Doctor, is that why we have speeded up the process of vaccinating different categories of citizens now because of these numbers? Not just in Maharashtra, it has to be said, a few other states as well.
Yes, that could be one of the reasons because we don't have an effective antiviral drug right now. What we have currently available is a vaccine which is effective, and it will help to at least decrease serious illness and mortality, and that will bring down the case fatality rate. And it will also help to break the chain of transmission.
Right.
So I think it's very important for us to start vaccinating as many individuals as we can, because as we're seeing in Maharashtra, we don't want the situation, a similar situation to develop in other states. And one of the ways to really prevent that is by vaccinating as many individuals as we can. This is a strategy which UK also adopted when they had a huge surge in the cases in the southern part of England.
So that is really my first question now. When will the process of administering vaccines to 60 plus citizens and 45 plus citizens with comorbidities begin? That's my first question.
So this process should start, I think, the first week of March, as early as possible. It may be even on the 1st of March itself, to some extent. It will possibly start at a slow pace, and once we have more and more vaccination centers coming on board and having the ability to do it, it will become a bigger movement, a larger movement, and I'm sure there will be a lot of participation of the private sector, which will really increase the number of people who can be vaccinated on a given day.
Doctor, how do you define comorbidity? People above 45 with comorbidities can get administered. So what is a comorbidity?
So comorbidities are, there has been a group which has worked on this and tried to develop what should be comorbidities, especially looking at those illnesses which could lead to a higher chance of that individual having landing up in hospital or dying because of COVID-19. So you have large number of comorbidities. Some of them may not be a risk factor for having severe death, but there are others which could be obesity, which could be diabetes, which could be heart disease, which could be cancers, which could be also people who are let's say having disabilities, which can lead to high chance of respiratory infection, or those who are on drugs which lead to a lower immune response, and we know that that can lead to a more serious pneumonia or serious COVID infection. So based on a criteria, you could be in that category and you could go and get yourself vaccinated.
What proof of comorbidities need to be produced and by who?
So for comorbidities, you don't need to get any tests done. If you have your records which show that you have got comorbidities, you can go to any GP or any doctor, either in the government sector and private sector, and based on the comorbidities that you have and a one-page pro forma which will just say that you have this comorbidities, and if it's signed and stamped by that doctor, then you are automatically included into the list. So it's trying to be more inclusive rather than exclusive as far as people with comorbidities is concerned.
How do citizens register and where?
So registration, as far as I can understand, would be based on two things. One is data which will be uploaded onto the COVID app based on the electoral roll, which will give you the age group. And then if you still are not there on the electoral roll, you could go to one of the vaccination sites or upload your data onto the app with your photo ID card. It could be an Aadhaar card, it could be your driving license, it could be your passport. But if that shows that you are in the priority group, you would be accepted into the vaccination program, and you would get an SMS on your registered mobile number. And then you could select a site near your residence where you would want to get yourself vaccinated, and then it could be using an appointment system as you would do for booking a railway ticket in routine practice.
Doctor, what if a citizen is not tech savvy?
So if you are not tech savvy, you could go on to the vaccination site. So I think there are two things that are being looked at. One is that you could directly go to a vaccination site. You will have a walk-in also available. Oh. And if you are carrying your photo ID card, the site itself will help you to register, and you will get registered onto the app, and you will get yourself vaccinated. Your phone number will be recorded, and you will get a reminder message when you have to come for the second dose. There will also be healthcare workers and other volunteers who could help people, especially in rural India, to really go on to the app, or who could help people come to the vaccination site and get themselves vaccinated. Because many elderly will not be able to come on their own. So you have to develop a strategy that they can actually be brought to the vaccination site, and a volunteer can help them get themselves registered, get themselves vaccinated, and then they could go back to their residence so that this could be facilitated.
Doctor, how many citizens are being targeted in this next batch?
So we are looking at as many as we can cover. The target always depends on how many people come forward to get themselves vaccinated. So the target would be something like maybe around 25 crores or maybe more than that. But a lot will depend on how many people come forward to get themselves vaccinated. I personally feel that we need to really develop a lot of aggressive strategy for getting public awareness and sort of getting over the infodemic, which is creating a lot of vaccine hesitancy. Because as we are seeing, there is a spurt of cases happening in different states in the country. One of the ways to really prevent this from really becoming another spike .
Right. We'll just come back to Dr. Guleria. Sorry, we've lost that line with him, but I'm going to get him to. All right, Dr. Guleria, we lost your line. Just carry on with your answer. Yes.
So what I was saying was that if you are able to vaccinate more and more people, then we could really prevent any surge in the number of cases, not only in Maharashtra, but in other states. And that is why we need to aggressively work on a program of getting more and more people vaccinated and getting people to come forward and get themselves vaccinated.
Where can citizens go to get vaccinated?
So now it's been opened up both for the government sector and the private sector. Many private hospitals which are part of the PMJ or are being covered will get registered, and they can therefore get the vaccine. The cold chain logistics will be worked out, and most of such hospitals already have facilities for storing the vaccine. The vaccine needs just an ordinary fridge. And if you can therefore have the facility to do it, you could become a vaccination site. And then based on the COVIN app, vaccination could be given at that private or government hospital or center.
So would these hospitals acquire the vaccines from the companies or from the government?
I think that is being worked out. Possibly it will be through the government, and some mechanism of how the payment process is going to be done will also be worked out by the government. But I think it will be acquired by the government, and the government will distribute it to all the vaccination sites, whether they're in the private or the government sector, so that there is some accountability as far as doses is concerned, and there's no misuse of the doses in terms of the priority group not getting it and other people getting it, or it being sold in the black market, if I may put it that way.
Dr. Guleria, how much will vaccine shots cost?
So I think that needs to be worked out. I don't think we have a definite costing that has been done, but I'm sure it's not going to be very much, because the cost of the vaccine is not very high. It's only around 300 rupees. And many of the private sectors, hospitals have come forward and said they will charge only the basic minimum charge that they need for the logistics. And that could be just the cost of a syringe, a needle, and possibly some degree for human resources. This is more of, I would say, a social movement to really get out of the pandemic, which is useful for the hospitals also, if they want to really come back and start having more and more patients coming in for routine procedures. So I think it will not be something which will be very costly.
All right. Can you get your second dose from a separate location?
You can. So I think one would like to really get people to get the second dose at the same site. But if you're traveling or if you're at a different place, using the COVIN app, you could still get the second dose at a different site if that is available at that site and they have the doses on that site.
Will citizens have a choice of the vaccines that they receive?
So this is something that needs to be worked out. It will create a little bit of confusion. So each site will probably have a given vaccine. It could be either Covaxin or Covishield. And if you get yourself vaccinated there, then you will obviously get the vaccine which is available at that site. Giving too much of a choice may create a little bit of confusion. And remember, we still have an issue of supply versus demand. The supply is still limited as compared to the demand that we are seeing. And therefore, we will not really be in a position to have too much of choices currently. As things progress and we are able to match the supply with the demand, the choice will obviously be available, and more vaccines will actually come into the market at that given point in time.
Okay. So that really is my next question. When will the additional stocks of vaccines roll out across India?
So there are two things. One is additional stock of the vaccines which are currently being made, and that is something which is happening on a regular basis. Both the companies are working on providing a continuous stock of vaccinations. But as we already know, Dr. Reddy's laboratory has also filed for emergency use authorization for the Sputnik vaccine. There is now published data of the efficacy of the vaccine, which is close to over 90%. And one is hopeful that in the coming few weeks, we will also have this vaccine available in the market. This will add to the number of vaccine shots available in India, which will be a big boost in terms of the absolute numbers.
Has Sputnik been cleared today, Doctor?
I'm not aware of that. That data will come out from the DCGI's office actually. But the meetings are being held and the data is being critically analyzed by the expert group.
All right, Dr. Guleria. So you've answered 13 questions. I meant to ask you 11, but thank you so much. Again, entirely in public interest. And we'll try and transcribe all your answers so that our viewers and our readers can actually understand. So many questions coming to us. Thanks, Doctor. I'm going to move on now. We've got a fantastic panel with us. Dr. Swati Piramal with us, Kiran Mazumdar-Shaw, Abhay Soy also with us, Professor K. Srinath Reddy and Dr. Sangeeta Reddy. Kiran Mazumdar-Shaw, let me come to you first, ma'am. Isn't this wonderful that we finally, move to that next stage? A lot of people would have said, look, it needed to have been done weeks back, this private-public partnership, but that's over and it's happening now. It's happening within days. Do you welcome this step?
Absolutely, Vishnu, because I think all of us were eagerly awaiting this announcement, and I'm glad that the government has actually advanced this particular deployment. And it's very important that the private sector get involved, because I think, ramping up vaccination is going to be much easier by having the private sector involved. As you just heard from Dr. Guleria, he absolutely covered everything in a very comprehensive manner. And I think what is important for us to remember is that the private sector hospitals are already involved in vaccine deployment in terms of healthcare workers, in terms of vaccinating, the frontline workers, essential workers. And now it's the next phase. So I think they've already sort of been, sort of brought into the equation. And I think they will actually ramp up and do a great job of vaccinating the next phase of, people who want to be vaccinated, who can be vaccinated.
Yeah. Dr. Piramal, would you agree that in India right now, given the numbers we are seeing in Maharashtra and elsewhere, we just don't have the luxury for this vaccine hesitancy business? The medicines are safe. We know that as a fact. We hope to get more efficacy data, this, that and the other. We hope to get more vaccines. But at this stage, what is your message to citizens out there saying, do I really need it? What is your message to them?
So there are 2 vaccines which are approved, undergoing the largest clinical trial of all that is in the market. So over 3 million people have been vaccinated. The number of side effects have been minuscule. And so they are very safe. They don't have so many as feared side effects as before. Mm-hmm. And really we need, with the help of the private sector, with the help of doctors, the medical fraternity, to convince people and have an advocacy campaign to vaccinate. I did a survey in my own company, and many others told me the same, that the number of people who want to vaccinate are very low yet, because everyone is fearful. But I think the advocacy is needed from the medical and pharma fraternity to actively support vaccinations and say there is nothing to fear. And vaccinations, whether it's this or that, do one single thing, and that is prevent very severe illness. Yeah. So you can argue about its efficacy and the data in between 2 doses, but in the end they really help prevent mortality. And so they, regardless of anything, COVID, fortunately, is a preventable illness.
Right.
And vaccine is given to a healthy volunteer. Mm-hmm. And so the efficacy is fantastic and its safety is fantastic.
Yeah.
It's the largest clinical trial of all. Is the market.
Absolutely. Abhay Soy, so a few weeks from now, if I were to go to one of the Max Healthcare facilities, how would it work for me? Would there be very long queues because a lot of people would be interested perhaps? Social distancing within the hospital space, so important. You don't want to end up getting COVID while waiting in line for the medication. And how many cases would you typically be able how many people would you be able to typically administer? I mean, any thoughts? It's early days, I understand, but what are your thoughts on that?
So, Vishnu, the way we are looking at it, each hospital of ours will have anything between 5 to 10 centers which will be providing these vaccines. We can provide 20 vaccines per hour. So, if you were to do a 24-hour shift, 24-hour day and 3 shifts in that, you will be doing close to, let's say, about 4 to 5 lakh vaccines a month. This is inclusive of, we've already segregated infrastructure for people to wait and then separately to be observed for half an hour. Mm-hmm. So hospitals are have large infrastructures. We can certainly absorb the sort of numbers that are required without putting people in harm's way, having adequate social distancing and everything. And moreover, I think if you look at some of the dead hours in the hospital, which is after 5 p.m., those are, during that time we can even use our OPDs and stuff like that. So I think clearly, I mean, if I look at the numbers, all of Delhi, I think would have, covered about 2.5 lakh people, healthcare workers so far. I mean, of course, we've, inoculated, 18,000 of our own healthcare workers in this time frame. We believe we can do 4 to 5 lakh per month, in fact.
4 to 5 lakh a month across India, right? across all your hospitals in India, right?
Well, largely in Delhi.
Largely in
yes,
Delhi.
absolutely. But largely in Delhi NCR, because that's where we have
the
a
bulk
geographical concentration.
of your facilities.
That's correct.
Dr. Srinath Reddy, the larger issue now is that while we welcome all of this, it comes at a time when the numbers in Maharashtra are let's face it, are awful. Bengal has now said that RT-PCR tests for anybody coming from Maharashtra, there are reports that Delhi is going to be asking or has already informally said that that must be the case. We've come so far down the road and we seem to be going back. Is that your concern?
Weeks ago, there was a great deal of confidence that we have substantially overcome this particular pandemic. But it now is very clear that we are seeing a spike in a number of states, and that's a cause for worry. And particularly since we have also started detecting mutants, whether they have come from abroad or whether they have been developed even inside our own country, and their propensity to infect more people in terms of their ability to spread faster and to more is also a matter of concern. I believe the threat perception having been diminished earlier among people, and also the belief, which I believe was very erroneous, that we have somehow acquired herd immunity all over the country. These have led to people not being particularly worried about the pandemic, and that has led to laxity in behavior. And I believe we now need to ensure that there are three different types of vaccines we need. One is the vaccine itself. The second is the social vaccine, which is essentially following all the COVID appropriate behavior of physical distancing, masks, and hand washing, and all the other precautions that we continue to need.
Right.
And third, I would also say, is the media vaccine, where not only you must counter vaccine hesitancy, but this feeling that we are now completely out of the woods because of herd immunity, that's a misconception that unfortunately also leads to people not wanting to take the vaccine at the moment. So if we actually make a concerted effort, we can still quell what appears to be a rising spike again.
All right. Dr. Sangeeta Reddy, how many people, citizens, would the Apollo group of hospitals and healthcare facilities be able to administer the vaccine to, let's say, on a daily basis? All right, I'm sorry, we just seem to have lost that line with her. We'll try and come back in just a moment and continue this discussion then. We'll take a short break and come back with the very latest on this very important development. Starting the 1st of March onwards, the private sector will be involved in vaccinating citizens above the age of 60 and also those above 45 if you have a comorbidity which is stamped and cleared by a doctor on a piece of paper. The process is trying not to keep you out, but they need something and they will try and include you in that process. The prices will be very competitive. They're working out the prices. This is absolutely critical. I think we've got Dr. Sangeeta Reddy back, but we'll take a short break and come back to Dr. Sangeeta Reddy and continue this discussion. Stay tuned. Welcome back. We're continuing our discussion on this very important development of public-private partnership launching on the 1st of March, where people will be vaccinated by the private sector as well if they want. I just want to go back to Dr. Kiran Mazumdar-Shaw, who joins us once again before she leaves us. You know, ma'am, we've been talking about this for weeks, and I don't want to be unduly negative, but at a time like this, when we've got these rising numbers in Maharashtra, which a lot of people would argue could have been entirely avoidable, would it not have made sense to do what we are doing now, maybe 3 or 4 weeks back?
You know, Vishnu, let's look at it this way. We started on the 16th of Jan, and I think we needed that 1 month to basically work things out and to basically ensure that the vaccination was not giving any unexpected, adverse events. So I think we've actually, used this time very intelligently. Of course, we would have liked to have seen more people being vaccinated. But as I always believe, it's never too late to start looking at what is required. We absolutely need to ramp up vaccination, and I've been always clamoring for it over the last few weeks. But I'm really glad that the government has taken this decision. Now let's focus on what we need to do going forward. I believe that, the world over, we are seeing mutant strains which are becoming very difficult to handle. We just saw an announcement from the US that in California, they are really worried about the mutant strains and the case fatality rate. We should be worried about the rise in case fatality rates in India. But I think vaccination is the only way of really, ensuring that we don't let people die. I think that's why vaccination is so important. And once people realize that it is protective from severe disease and mortality, I'm sure people will come forward and get vaccinated. So I just think we need to get people to understand that this is about stopping transmission and protecting people. And if we can get that message clearly across, I think many people will come and get vaccinated, and the vaccination process ought to be a walk-in vaccination process to make it less cumbersome and very rapid.
Yeah. I think it's almost going to be that. I mean, is what Dr. Guleria seemed to indicate. It's going to be not that difficult. Yeah. Thank God for that.
Yeah, because getting appointments and going to places is not really the best way of ramping up vaccination.
Yeah.
So I think we just need to get all hospitals, and you've just heard many of them say that they are in a position to vaccinate at scale, and that's what the private sector should be used for.
Yeah. Dr. Sangeeta Reddy, how many vaccinations can you get done in a day across the country in your various healthcare facilities?
Dr. Devi
so Vishnu,
I
think 20,000 vaccination centers in the private sector and 10,000 in the government. If you look at the rough math of this, some centers like, the larger centers, we can go up to 1,000 vaccines per day, but you take an average of 200 vaccines per day. The country can technically, with this number of 30,000, do about 60 lakh vaccines per day. So this is a significant number, and you will see a large number of people now coming forward. I think I want to make one statement in the beginning, that we must commend the methodology which the government has used, actually, because it's a public health approach. You start with the healthcare workers, you go on to frontline workers, and then you move to the elderly and the vulnerable. This is a public health strategy which is being implemented. Now you implement this strategy with government and private with a strong underlay of an IT infrastructure. This IT infrastructure needed to be rolled out, tested, put in place, because this is the single thing which is going to ensure the validity of the vaccine being given, the certification which you can give people, because that needs to be accurate, and a tracer so that we can give the second dose at the right time. So all this needed the core IT infrastructure. Now it's for all of us to also play a role in finding ways to link our IT systems along with the CoWIN and the centralized system, so that together we can make it easy for the consumer. We can ensure that there is a universality of what's happening in India and a correlation, and also very significantly, we can keep a good track of patients who need to come back. I also want to highlight the fact that we need to get into details on which are those 20,000. We must quickly figure out the numbers. We must give each center a code. This code has to be correlated to the central site. So this week is going to be a busy week, but it's a week we've been waiting for, and all of us can ramp up and get this done. We're very committed to doing it. This is a public health service, and we're viewing it in that manner. We need to understand whether we have to procure the vaccine or the government is giving it. I think in the first phase, this phase, the government will continue to supply. But we've also made arrangements for an ongoing subsequently, how do we handle the cold chain? And I want to reiterate that the clinical monitoring post-vaccine and the insurance of coming back and taking the second dose, these are two very important steps which also we are prepared to do and ready to do.
Yeah.
So it's a very good development in our overall recovery.
Yeah. Dr. Piramal, just going forward, are you also encouraged by the number of vaccines which are progressively going to come online?
Yes, I was a jury on a Economic Times Award Committee, and we realized that there are 21 vaccine research companies in India alone. And, vaccine has this problem that it has a long lead manufacturing time. And the number of vaccine manufacturers are limited worldwide who meet WHO standards. But we are very lucky in India, and I think I'm very proud of the strength of the Indian pharma industry, that we have as many as 21 vaccines doing research in new variants and new vaccines, in new methods of developing. Some look at the whole virus, some look at the spike protein, some look at, a dead virus. So it's just a vast type of implementation in vaccine technology. And that is very heartening for India that we are in this research. It's remarkably hard to do a vaccine clinical trial. You need thousands of patients. It's very different from our pharma drug discovery units. And therefore, the safety is most important. And we have to assume that the elderly who are 85 and 65 are generally not part of a clinical trial.
Right.
But in market, we assume that they will be the same as a younger population. Sure. We also don't vaccinate children.
No, not yet. Trial. Yeah. Dr. Srinath Reddy.
So these are the little nuances of vaccine technology and research. It's a fascinating area.
It is. Dr. Srinath Reddy, are you concerned about schools being opened in so many parts of the country at a time like this?
Well, I think we do need at some point in time to open the schools. We can't let the children's education suffer. However, we must take adequate precautions. Firstly, we must ensure that the vulnerable adults, whether they are the school teachers, other staff in the school, the transport personnel who bring the children to the school, all of these people are protected by vaccination, and then we open the schools. Apart from, of course, ensuring that they continue to maintain all the precautions that we have mentioned about masks and hand washing and maintaining a certain modicum of distance. Now, it's also true that children are less likely to be severely affected by the COVID-19 infection. They must also be encouraged to take personal precautions. But the important element is to ensure that during their passage from the home to the school and back from the school to the home, they are not going to be exposed as much. But most importantly, the adults they come into contact, whether in the school or at home, should not become victims of COVID transmission from the children.
Yeah.
And therefore, immunizing even school personnel as a priority would be a very important element, apart from all the other groups that we have mentioned, in terms of both essentiality of work as well as vulnerability of disease.
Yeah.
But ultimately, at some point in time, you have to get back to schools. Otherwise, the schooling, particularly of people who do not have digital access easily, is going to suffer a lot, and that's going to have a huge impact later on.
Absolutely, I couldn't agree more. But those steps that you list are absolutely crucial, and perhaps there needs to be that effort by the government to announce that school teachers, those who assist children in school, whether they are bus drivers or they are attendants in school or there are guards in school, they should also be perhaps be considered in the same category as frontline workers. If you're dealing with children who aren't going to get vaccines for the moment, then they need to be protected as far as possible. I would agree with that.
Absolutely.
I'm just running short on time. I wanted to go back to Mr. Soy. Mr. Soy, just going forward, are you at this stage a little confused about costing, where the vaccines are going to come from? Is it going to come from the government, or are you going to have to reach out to the companies? And then, of course, the process of different vaccines coming out, how exactly are you going to get these stocks? Because we're talking about huge numbers here. Where is it going to come from? Is that all something you're sort of grappling with?
So I think as far as the procurement process is concerned, Dr. Guleria did mention in the previous interview that it is at this stage going to be procured by the government and will be provided to the private sector. I think we would be very happy to procure it on our own directly if possible as well. But at this stage, if that is the case where the government is procuring it, so be it. As far as production capacity is concerned, at least, some of the media I had read previously that the Serum Institute itself is looking to go up to a capacity of 100 million vaccines by the month of March. So I think, at least as far as availability of vaccine is concerned, it should be adequate. Now, which vaccine will be available in which state, in which city, and so on and so forth, I think we'll leave that to the government. At this stage, what I can tell you is, for example, we have inoculated about 17,000 of our workers with, and 70% of them have come forth, 75% of them have come forth and got themselves inoculated. But at the same time, we've only had 60 odd people who had any form of even mild adverse reaction. So look, I think this step is very welcome. I think it's been sort of advanced by the government. They were speaking about middle of March sometime, and now they brought it up to the 1st of March. And we'll take it from there. As far as we are concerned, this is calling by our Prime Minister that both the private sector as well as the public sector should collaborate in this public service, healthcare service, and we shall do so.
Well, I'd like to thank all of you very, very much for joining us. It's been fascinating to hear all of your views, and in as much as the news from Maharashtra isn't good, there is a sense of hope which we really need, so many across the country. Thank you very much indeed. Well, up next, the Motera Cricket Stadium will now be called the Narendra Modi Stadium, a part of a larger sports complex named after Sardar Patel. The question that we are asking tonight: should public spaces in India be named after political leaders? This is a reality that we've had in this country for decades. Why, for example, is it that we don't have cricket stadia named after cricketers while there is no dearth of them? And instead we've got political leaders who define the names of so many cricket stadiums in our country. Very good. That's our next debate right now. Joining us at this stage is Geeta Bhatt, and we're also joined by Sanjay Jha. Sanjay, let me come to you first. Is this a legacy of the past where, for example, in a 2012 RTI, and I don't know, you don't speak for the Congress, but according to a 2012 RTI query, the Nehru-Gandhi family names have been used for a whopping 450 different schemes, projects and institutions, including 28 sports tournaments and trophies, 19 stadiums, etc., etc., etc. Is this something that our political leaders, when they come to power, just like to do?
Oh, well, Vishnu, I think you hit the nail on the head. The Congress party, while yes, it has had some phenomenal stalwarts as the head of government, definitely went over the top in naming several infrastructure projects, sports stadiums, airports, ports, behind the name of its political leaders. And I think the BJP is perpetuating that political branding obsession that I think all politicians have. The problem, Vishnu, is that vanity seems to consume all politicians at some point or the other. I actually believe that Mr. Modi, being a very smart, astute, savvy politician who knows that this has been his severe criticism of the Congress party trying to basically promote the dynasty, he would not fall into the same trap. But clearly he has. I think I call it as the kamikaze or the harakiri moment for Mr. Modi, because it damages his reputation in a very significant fashion. And the other part which you mentioned is so bang on. Can you imagine India winning the Lord's 1983 test, and we are talking about Margaret Thatcher Stadium at Lord's, or we have our historic victory at the Boris Johnson Stadium at the Oval. I mean, it sounds rather absurd. The Australian Open has just got over, Vishnu, and we saw they have an Rod Laver Arena, they have a Margaret Court Arena. In the US Open, they have Arthur Ashe. I think in India, we don't celebrate our sportsmen as we should. And the biggest example of that is that both the BJP and the Congress do not choose people to head sports ministries who are really people who have a passion for it. I think maybe Mr. Rathod to some extent has been an exception, but I do believe that we need to take our sports a lot more seriously and lionize and celebrate our great superheroes.
So Geeta, I tend to agree with what Sanjay says to a large extent. Wouldn't it have been wonderful, for example, if we had a Sachin Tendulkar stadium or a Sunil Gavaskar or a Kapil Dev cricket stadium? And one knows the role that Mr. Modi has played in cricket governance along with Amit Shah in Gujarat. So that's not the point of which I'm looking at only. I'm just trying to understand, should it not be the case that we have stadiums named after cricketers?
Well, Vishnuji, what you have floated is something that definitely can be discussed, and it is for the cricket associations and the other sports bodies who can look into it. But I would like to put forth 2 points over here. First is that this has become a topic of debate only on the day when the Motera Stadium has been named as the Narendra Modi Stadium, cricket stadium. Also, you have already yourself listed, that how Congress, which ruled for 60 years, how the large number of stadiums, institutions which have been named after them. Not only that, even Bharat Ratna. Jawaharlal Nehru got Bharat Ratna in 1955, when he was very much alive and the Prime Minister of the country, and so did Indira Gandhi in 1971, when she was herself holding the position of the Prime Minister, and Rajiv Gandhi also got it in 1991. So, keeping that thing aside, the second point is that it is not about naming a stadium after just a politician. Narendra Modi is the Prime Minister, not only the Prime Minister of the country, but also one of the tallest leaders across the world, who's been named as the most popular leader across the world for a consecutive number of years, and is a very, very popular leader where people, Indians, whether from rural or urban background, whether young or old, men and women, they all believe in his leadership. And also technically, one point which you brushed a little bit, but I would like to put forth it, that one needs to also look into the history of naming of the cricket stadiums. Yes. And if you look into that, you will find that most of the stadiums are either named after the places or after the people who have been associated with cricket administration. For example, Wankhede Stadium. Why till now no one has questioned why it has been named as Wankhede Stadium? Mr. Wankhede was a politician and later looked after the Cricket Association of Bombay, and later was the president of BCCI. Why is it that the Chennai Stadium is known as the Chidambaram Stadium? Because Mr. Chidambaram was also related to cricket administration and held such kind of posts. And Mr. Modi, while his tenure in Gujarat, was also for a very long period of time the president of the Gujarat Cricket Association. Now, the stadium is owned by the Gujarat Cricket Association, and they decided to name after one of its ex-presidents. And this is just
no, but Geeta, if I can just, do we have this
right, sports complex? There are going to be 20
No, but Geeta, one sec, Geeta, can I also jump in and ask a question? Sure. No, Geeta, I think what needs to be asked is also something which is a lot of people would raise questions on. The president of the country arriving in Gujarat today to unveil this particular stadium named after the Prime Minister, a stadium which has always been referred to, either as the Sardar Patel Stadium or as Motera or just Motera. And then I understand the role that Sardar Patel's name will take, larger sports complex, that's been made very clear. However, was this at all necessary? Because the names were so strong and established in the past, Sardar Patel or Motera. We've all grown up with these names for a wonderful cricketing destination. Why change it?
Vishnuji, as I just said, you see, it is more than 200-acre complex where there are going to be 20 state-of-the-art stadiums, and it has been announced by the government that these are the facilities which will be, which will be ready for even holding Olympic events. This the kind of state-of-the-art stadiums are going to be built over there. Now there are going to be 20 more stadiums which are going to be built in that complex. Now, each one of them is going to be named after some different personality. Now, one of the stadiums, which of course is one of the largest, is the largest cricket stadium in the world, yes, has been named after Mr. Narendra Modi. So, this is an unnecessary controversy which is being created.
Okay, an unnecessary controversy.
It is the GCA which has.
All right, one second, Sanjay, you wanted to reply to that?
Cricket Association.
Yeah. Geeta, just 1 second. Yeah, Sanjay, go ahead.
Yeah, Vishnu, with due respects to Geeta ji, she's made some valid points, but I do believe that politicians, yes, they make a contribution to the country. Both the BJP and Congress leaders have done, milestone works in the past And it's understandable if an infrastructure project, a one-off, and not too many, just one or two may be symbolic of their contribution to India's progress. I can understand that. But, sports needs to be treated differently. End of day, what is sports? And it's a representation of one's individual talent or a collective effort to win a trophy or to give India the glory it deserves. And I think if we are not going to celebrate a Sunil Gavaskar, a Rahul Dravid, a Sachin Tendulkar, a Vinu Mankad, I mean, how many of the young today know Vijay Hazare, Vijay Manjrekar, Nari Contractor? I mean, there are stalwarts in this country that we don't even talk about. I do believe that the BJP and the Congress need to collectively come together and pass a law with the entire parliament backing it, that we will not have politicians being named after any project in the future. What's done is done, so let's accept it. I mean, it's a fait accompli, we can't change it. But going forward in the future, shall we please celebrate our hockey players, our football players, our cricket players, badminton, tennis, whoever? And I don't think we do enough of that. This is a great disservice, I believe, to the sportsmen of this country who make us feel so proud. I mean, Geeta ji, for example, when we won that series in Australia, beating Australia in Brisbane, I'm sure you were feeling very proud as an Indian, right? So why shouldn't we celebrate those people who do it for us? I'm not taking away from the contribution of the Congress and BJP leaders, but I think politicians have no right to anoint their names as brands on taxpayers' money when politicians anyway have 99% media visibility.
All
I think
right.
Mr.
Okay,
Modi's
one sec. We're also joined,
Sanjay,
I'm also joined by Ashish Ray, who's been tracking this quite closely. Mr. Ray, what, your thoughts on this? On the one hand, Geeta Bhatt makes the point that he is the tallest leader in the country. What's necessarily wrong with that? On the other hand, we don't have any major cricketing stadium named after a cricketer in this country. What sort of messaging is this about? What message does this send?
It's a very wrong message. It shows that there's no cricket culture in India. There has really been this culture lacking for a very long time. Why not name that stadium after Vinu Mankad, the greatest Gujarati cricketer of all time, the man who was the fastest to 1,000 runs and 100 wickets in Test cricket, a record he held, a world record he held for more than 20 years before Ian Botham defeated him on that and got his 1,000 runs and 100 wickets faster. So why not after cricketers? That is the point. Narendra Modi, it's a very disappointing decision. He knows nothing about cricket. He has nothing to do with cricket. And politicians, whether it is the Rajiv Gandhi Stadium in Hyderabad, the Arun Jaitley Stadium in Delhi, and of course the cricket officials who have named their stadiums after themselves, the Wankhede Stadium, the Chinnaswamy Stadium, the Chidambaram Stadium. These are all absolutely necessary. If you must honor somebody, then honor a cricketer. And let me just say this, that the Eden Gardens at one point of time, and very few people remember this, was named after Ranji. It was called the Ranji Stadium. Nobody knows this. The Cricket Association of Bengal has conveniently forgotten about this. The clubhouse at Calcutta is named after Dr. B.C. Roy, a former Chief Minister of West Bengal. Why not after Pankaj Roy, a distinguished batsman for India?
No, I see the point that you're mentioning absolutely clearly. But would you say that, this, Mr. Ray, has resulted in, a political battle? You've got Rahul Gandhi making statements saying there is a Reliance end on one end and Adani end on the other. The stadium is called, the Modi Stadium, and, it's just political fuel. Instead, we aren't celebrating cricket at all.
Well, there are instances in some parts of the world of people sponsoring the construction or reconstruction of a stadium, as for instance the Oval in London, which is now known as the Kia Oval. There is the Old Trafford in Manchester, which has been sponsored by Emirates. But having said that, the really premier grounds, whether it's Lord's in London or the Melbourne Cricket Ground, the Sydney Cricket Ground, they are all named after their original nomenclature. They have never changed. Nobody's name has been put, not even a cricketer. Some stands have been named after cricketers, but not an entire stadium. I have nothing against a stadium being named after a cricketer, a really outstanding cricketer, but not a politician's. particularly a politician who has nothing to do with the game. I would imagine John Major, who knew a lot about the game, has never named any stadium after himself. He was a distinguished member and still is of Surrey County Cricket Club.
All right. Well, I'd like to thank you all very much for joining us. Let us remember the contribution of our cricketers. Hopefully one day we'll have a stunning stadium named after Sunil Gavaskar, Kapil Dev or Sachin Tendulkar, perhaps the greatest icons in Indian cricket. I'd like to thank you all very much for joining us.